And there is a mental stigmata that comes with atopic derm. And you see it with kids that don't want to go to school, shut-ins, conduct disorders, behavioral disciplines. And it's actually associated with ADHD and some forms of autism. So you got to be careful, especially some people don't actually want to go to work. So now you're starting to affect economic lifestyles.
So in terms of the ADHD or the autism, do we know what the relationship is? Is it?
So they talk about behavioral, they talk about this intense itching for the atopic derm, and they're constantly itching so you can't focus on other things that are right for you because it's that itching that won't stop, especially as you get to the more severe forms of atopic dermatitis. And so that's when you have to start thinking about stronger medications, whether it be oral or biologics. There are different meds that have come out. Opzelura is one topical that's a JAK inhibitor, and the JAK inhibitors are the Janus kinase inhibitors. They're pretty much the inhibitors that are like a valve. I'm going to stop all the inflammatory reactions, all the cytokines, instead of targeting one particular enzyme or interleukin that could be the specific cause for atopic derm. But one of them is Opzelura. Opzelura just recently came out, but it's for ages 12 and above. And even though it's a topical, it does carry side effects like other JAK inhibitors, possibility of blood clotting or with upper respiratory tract infections. Oral ones like Rinvoq or Cymbuco also came out in their JAK inhibitors, but they also are associated with heart disease, stroke, immediate death, or risk of blood clotting. So you have to be careful of them. You have to look at your patient at that point and say, are they a candidate for these meds? Biologics are great. Dupixent is very popular, and Adbry is another one that just came out, but those are the interleukins. It's going to target something specifically, interleukin 4, interleukin 13. And they carry less heart side effects, but more so injection site pain that can come with it, pink eye or conjunctivitis, or sometimes upper respiratory tract infections. But they're a little bit more or less harmful. But then you have to get past whether your patient would rather orally take a med or inject themselves. And that's another psychological issue you have to deal with. No one wants to inject themselves. But then more and more people, I guess, are becoming more affluent about biologics. So just trying to figure out what one works for the other.